So I think with that being said, we'll get started. So this is Ed Crow. Thanks for joining me today. Today we're going to go over OneShare, talk about the OneShare HealthShare plan. So we'll talk about what a HealthShare is, for those not familiar, talk about the details of the OneShare plan, go over some samples and examples of the plan, info, and contributions you got to pay to be a member, and how to get contracted. And again, if you have any questions along the way, just send them into the webinar, and I will try to answer them for you at the end. So first, we'll start with what's a HealthShare program. Well, a HealthShare is they're all kind of lumped together in the general term Healthcare Sharing Ministries, HCSMs. There are a number of companies that offer them. They are acknowledged by the ACA. They have an exemption from the ACA, so they're not flying under the radar. They are set up as a nonprofit organization. They have to meet certain criteria to be able to be a OneShare and offer programs to members. So Healthcare Sharing Ministries are set up the same. Some will be of different faiths. So Healthshare Caring Ministry, some require that a person be of a certain religious faith to participate in the ministry. Others don't require any specific type of religion. They just require you be a person of faith. They are not insurance plans. They certainly act, look, and work like a health insurance plan, but they aren't health insurance. So you got to be really careful when you talk about health shares, not to refer to them as insurance and not to use insurance terms with them. It's one of the big things. When you describe them, you got to get used to using other lingo. So instead of saying your monthly premium, you'll hear me say monthly contribution. Instead of calling OneShare a HealthShare plan, you're supposed to say a HealthShare program because these are programs. So you'll use monthly contributions instead of monthly premiums, but that's what that means. ISA, individual share amounts, or if I say share amount, that means deductible or copay. But again, a HealthShare is not an insurance policy. It's not regulated by the insurance department. As I said, they are acknowledged by the Affordable Care Act. They have an exemption to operate, but they're not an insurance plan. So you'll hear me use these terms, and you got to, if you're going to offer these, you got to get used to the same thing because you can't imply that they're insurance policies. They are, even though they kind of work in a similar manner to one. So the ACA grants them an exception from the ACA requirements, meaning back when there was a penalty for not having a health plan, if you had a health share, that penalty would be waived. To participate in a health share, you got to attest to a statement of faith. So OneShare specifically says you have to attest that you're a person of faith. You don't necessarily have to prove it, you just have to attest to it. We use OneShare often because they don't require any specific religion, and there are a lot of health shares out there that do. There's 9 or 10 health shares operating in the country now. Some are Christian, some are Jewish. There's a variety of them. OneShare happens to be non-denominational. It's just a plan of, you got to be a person of faith. So we'll talk about some of the details. I've got a quick change here. OneShare uses the multi-plan PHCS network. I've got an update. I didn't even have time to include it in the presentation. But it's going to use the First Health network now. So for a few years, they've been using PHCS. They've now decided to switch to First Health. So make note, it says multi-plan PHCS network. The national network is First Health. That's the network they use now. They have unlimited telemedicine. So you can access doctors online through the phone at no cost. They actually can prescribe you medication. And there's no cost share. There's no, out-of-pocket expense for doing that. So somebody, for example, obviously if you're having a heart attack, you're not going to call telemedicine, but if somebody has, maybe they feel they have strep throat or they have something else that's a basic condition, they could get on the phone, get on their computer, dial up for the unlimited free telemedicine and get a prescription over the phone after they talk to an MD. This plan has RX discounts on drugs, so for people taking prescriptions, it's a discount-only plan. Those familiar with GoodRx, it works in a similar manner. They give you the discounted price of the drug. It's going to work just fine on generics. So for generic drugs, with the discount, you'll pay very little to nothing for them. For example, I take a blood pressure medication. Without the discount, it's like $100 for a 3-month supply. With the discount, it's like $16. RX discount plans do not work well on name brand drugs, though. So if you have a client that's taking Xarelto, it's not going to help. What I do is Their discount is pretty good on the OneShare, but you might want to double check GoodRx. If you haven't used GoodRx.com, it's free. You might want to check it because sometimes they have a better discount, so you can jockey back and forth. There's vision and dental discounts on this plan. Make note that there's a $125 one-time application fee for people who apply for this plan. So it's $125 one-time application fee. When I talk about the monthly contributions, and remember that means rates. In insurance terms, that would be rates, but for HealthShare, it's contributions. When I talk about the monthly contributions, you got to tack an extra $30 on to whatever I talk about because they've got a $30 monthly admin fee because they're HealthShare. I guess they have to set it up that way. But it's only $30. It's $30 for an individual or $30 for a family. It's not per member. It's just an extra $30 on top of whatever I say the monthly contribution is. When people are interested in the OneShare plan, you can enroll them through your agent portal. They don't have paper applications. It's all done through the agent portal. It's an easy process, pretty friendly and easy to use. They will do next day effective dates, which is nice. If you've got a person who says it's June 5th and I don't have a health plan of any type, I'm looking for something, you can enroll them and have them active on June 6th, so the next day. You don't need a special election to enroll in HealthShare. People can enroll any month. You don't need a qualifying event. There's no, they don't have to wait till January. They can enroll when they want. Like every HealthShare out there, there is a 24-month pre-X. So on any major medical conditions, they're going to pre-X that for 24 months. In other words, they're not going to cover it, with the exception of some basic services. So if somebody has basic pre-existing conditions, something like that's very manageable, like diabetes that's treated with medication, thyroid, high blood pressure, cholesterol, those things aren't pre-X'd, so they'd be fine with those. But if somebody comes into this plan and they're, just recently had a shoulder surgery or have shoulder issues or had a heart issue, there's going to be a 24-month pre-X on that, so it won't be covered. And you'll find that's pretty much indicative of all HealthShares out there. They have a 90-day wait on major services. What does that mean? It means you're covered for emergencies. So in the first 90 days, if you're on a HealthShare, if you go to the emergency room, you're covered if you have an emergency or an acute illness. So if you get sick or if you have an emergency or you, God forbid, break your leg, maybe you come down with an illness, you're going to be covered within the first 90 days. You're covered immediately. What wouldn't be covered is a scheduled doctor's visit or something that was planned out that isn't emergency or acute. So maybe you set up an appointment with your dermatologist. You'd want to push that back because in the first 90 days, if it's not emergency or acute, it's not going to be covered. This is one of the few HealthShares that will cover maternity. The inception date, of course, has to be after they enrolled in the plan. Preventative services are also covered day one on these plans. So routine annual physical, regularly scheduled colonoscopy. What the ACA defines as preventative care is covered on this plan from day one. So they offer 3 program levels. In the insurance world, we'd say 3 plans, but here it's 3 program levels. They have the complete, the classic, and the catastrophic. The complete is the most comprehensive, but it also has the highest contributions on a monthly basis. So it costs the most, covers the most, costs the most. The most popular plan is the classic. It's kind of a middle-of-the-row option. I'm going to show you the benefits of that. And then the lowest cost option is, of course, the catastrophic plans. They usually have a $5,000 or $10,000 cost share. Remember, in insurance, that'd be deductible cost share in the HealthShare world. They have a $5,000 or $10,000 cost share, and then you're covered after that at 100%. On their catastrophic, they do cover emergency room and specialists prior to meeting the cost share, however. So emergency room is $300 a visit, specialist is $75, even if the cost share hasn't been met, which is a nice benefit. So let's talk about a couple plans. We'll talk about the Classic Crown. Like I said, that's one of the more popular plans, middle-of-the-row option. Classic Crown covers 100% preventative. $20 cost share. Remember, in insurance, that's copay. So $20 cost share for a primary visit. You get 5 visits per year at $20. The question comes up a lot, well, what if you go past 5? Still covered. But if you go past 5 visits, it's going to go towards your major services cost share, your individual cost amount, that you got to meet. So They'll still cover it. You'll still get the negotiated rate through the First Health Network, but it's not going to be $20. Specialist is $75 unlimited. Urgent care, you get 2 visits for $20. Same thing. If you go over 2 visits, then it's going to go towards your individual cost share. You get $300 per ER visit, and that's prior to meeting the cost share. So that's a nice benefit. They have an end-of-life sharing benefit. It's basically a death benefit. So if somebody's on the plan for at least 12 months, they will contribute $6,000 for the primary member. If they pass away, $6,000 would be paid out for end-of-life sharing, more or less a death benefit, but it is a health plan, so it'd be paid out in the form of a health plan benefit. Give you an idea of the sample monthly contributions. I used a 40 to 49-year-old. Individuals $398.63, member plus one's $554, and family is $769 a month. If you compare that to an ACA plan without a subsidy, you'll find that it's substantially less. It's almost about half of what a health plan without a subsidy would be. Now, of course, people will ask me, well, what if somebody can go on the exchange and get a subsidy? Well, that's the better option then. If your plan's $700 on the exchange, but the state's going to kick in $650 and you can pay $50 a month, it works better. This plan will be for people who don't have coverage at all, or maybe for people who can't get a subsidy on the exchange, which is a lot of people. Classic Crown program has limits. They are limited to $500,000 per incident per member. They're limited to $1 million lifetime max. So there's limits, but they are pretty substantial. The lower cost plans, like the catastrophic plan, they have lower maxes. There's a catastrophic plan with a $250,000 and $500,000 max, but they are lower. But then the contribution per month is much lower as well. These plans aren't available in Pennsylvania, Maryland, and Vermont. So when somebody applies, remember they get next day effective dates. ID cards are emailed to the applicant the day after they apply, and then permanent cards are mailed out. So you get effective dates right away, and you get cards right away. They just got to print them because they're temporary, and then the real ones come in the mail. Here's an example of a catastrophic plan. Like we talked about, unlimited telemedicine, discount program on the drugs. As you see, specialists are $75 per visit. Emergency room is $300 a visit. Everything else, basically, other than preventative, x-rays, inpatient, outpatient surgery, hospitalization, primary visits, all those things go towards the major services cost share, which is either $5,000 or $10,000. You choose the level you want. Here's the classic plan. There's 3 versions of the classic. The most popular one's the Classic Crown. Preventative services, so that's the one to the far right. Unlimited telemedicine, again, discount on the RX. Preventative service at 100%. This is the plan I had reviewed. $20 for primary. That's 5 visits a year. Urgent care, $20. 2 visits a year. Unlimited specialist is $75. Unlimited emergency room at $300. And then x-rays and labs done through the PCP are covered on this plan and not applicable to the major services cost share. Everything else basically would go towards the major services cost share on the plan. But again, that's one of the more popular options available. That's the Classic Complete. I find that the monthly contributions are fairly high on that. We do sell some of them, but and the benefits are comprehensive. But you pay a fair amount more. I'm going to give you an example of rates in a minute. But as you can see, it's the plan to the far right. Same thing. It's just there's no limits basically on your primary visit. Your urgent care visit has no limit. So that's a big difference. And then also hospitalization or outpatient surgery is covered at 80% prior to meeting your major services cost share. So it's a better plan, but it comes at a much higher price. That's the basics of the plan. If you do sign up, you'll see they have 3 versions of each. So 3 versions of the Classic, the Complete, and the Catastrophic. And you can kind of pick and choose what you think the best price points are. Like I said, the Complete to me is a little pricey. I like the Classic, either the Classic Enhanced or the Classic Crown, but I leave that up to you. It depends on on who you're talking to, and I guess what you think works best. Contracting on this program is basically pretty straightforward. The commission on this is 16% level, meaning as long as they're paying their monthly contribution, you get 16% as a commission. There are GA and MGA level contracts available. You got to have a number of sub-producers in order to get the GA or MGA. If you have questions about that, simply call me. Health shares do require E&O. So OneShare, you can do it one of a couple ways. If E&O is included, or if health shares, if I can spit it out, if health shares are included on your E&O, then you're all set. Odds are, though, that your E&O does not cover health share. We were able to get a rider because our E&O is through Lloyd's of London, and they're a little more flexible. But a lot of the, your common E&Os like Napa, Calsurance, they won't do it. OneShare has their own E&O that they provide, and we will pay for the first year of it. So if your E&O doesn't cover health shares, we will give you an E&O through OneShare for a year, and we'll pay the $130 cost of it. Second year, then that would be your cost that would be passed on to you if you wanted to use the E&O through OneShare. Whenever we quote these monthly contributions, just keep in mind you got to add $30 to whatever I was talking about there. To sell this plan, you'll need to have a license in a resident state. So if you're, for example, in Connecticut and you want to offer this in Colorado, if you're licensed in Connecticut, you can offer it in Colorado. You don't have to be licensed in the other states, only your resident state. Because this isn't an insurance product, they will probably do away with the need for a license altogether at some point. They haven't yet. Because if you think about it, it's not an insurance product. Why do you need a license? I think right now they're doing that just to show that the person, kind of understands benefits and has a license in your resident state. Everything online, we will simply send you a link to fill it out. And like every health share out there, the way it works is you fill out your online contracting, and then they give you a test online. So they give you information that you read online. You read it, and then you take an online test. What's the test about? People ask me a lot. The test is more or less two topics. It'll cover the benefits of the plan, the member benefits, so the cost shares and making sure you understand how the plan works. But then it also will test you on using the terminology for a health share as opposed to an insurance plan. And that's tricky for me even. I've slipped up like 5 times already on this webinar. You'd say health share program instead of plan. You'd say, cost share instead of copay. Monthly contribution instead of premium. So they test you on those types of things to make sure your lingo is in line with a health share program. That's it. Pretty straightforward, like I said. I will record this webinar. I'll send it out to you. Any future webinars you want to watch, if you can't make it, just register and you'll get the recording whether you attend or not. If you have any questions, you can call us, 203-796-5403. We're still on limited staff because of COVID here in Connecticut. So if you want, it might just be better to email us. You can always email me, edward@crowandassociates.com. You can see my email at the bottom there. For contracting, email Lisa at crowandassociates.com, and she can send you out your link to get set up. What I'm going to do at this point is see if we have any questions, because sometimes with health shares we do get questions. Now, it doesn't look like anybody had any questions, so either means they did a great job or it's nice out and nobody cares. I'm not sure which. But either way, if I'll wait another second here if anybody's got any questions they want to send into the webinar, I'd be happy to answer them for you. Otherwise, like I said, just email Lisa if you want for contracting, or if you have or questions for that matter, or you can email me too. Either way would be fine. We do have staff here, but like I said, it's just reduced. But we're here all day, but it's just usually one person at a time, which makes it rough. So I don't see any questions coming in. So other than that, I appreciate you joining me today. And if you have any questions, give us a call. Thank you.